Chapters 7 and 8 in the text deal with two concepts that are interrelated. In order to understand health and behavior, you also need to know something about the factors known as social determinants of health to explain what drives behaviors. Although we will discuss health-related behaviors, keep in mind that even though behaviors are very difficult to change, there's another layer of complexity. Those factors such as education level, socioeconomic status, and environment that influence behaviors. We've already had some discussion about how health behaviors affect health status and in turn affect the health of the population. If you've ever tried to change a behavior, you know that's difficult. We often focus on how individuals change their behavior, but we have to come to look at how can we change behavior in groups of individuals. We will discuss in this chapter how policy and the culture in which we live affect our health and health-related behaviors. The text provides us with models for addressing change in health behaviors and what types of interventions can impact national quality objectives. We know that personal behaviors are associated with increased or decreased risk for illness and death. The most important of these are tobacco use, alcohol abuse, sedentary lifestyle, unhealthy diet, and being overweight or obese. Modifying these behaviors is associated with improved health and improved quality of life, as well as a reduction in healthcare costs. Over 90% of us have at least one of these risk factors, with over half having two or more. Individuals with multiple risk factors tend to be low income and belong to a racial or ethnic minority group. Healthy People 2020 has set objectives for the reduction of tobacco use, alcohol abuse, sedentary lifestyle, unhealthy diet, and overweight and obesity. You might ask, how are we going to achieve these objectives? We know that smoking is related to poor pregnancy outcomes, sudden infant death syndrome, ear infections, and large medical costs. Although smoking prevalence in adults has decreased, nearly 1 in 5 adults still smokes, with the highest rates among low-income populations. Probably the most troublesome group are children and teens who become addicted to tobacco before they graduate high school. About 5% of the adult population in the U.S. meet the criteria for alcoholism, and 20% engage in harmful or risky drinking like binge drinking. Health risks associated with a sedentary lifestyle include heart disease, type 2 diabetes, stroke, hypertension, osteoarthritis, colon cancer, depression, and obesity. The Healthy People 2020 guidelines for physical activity require weekly moderate to vigorous activity of 150 minutes per week with additional health benefits with more activity. Children and adolescents should engage in an hour or more of physical activity daily. Both adults and children should also do muscle strengthening activity. Lower income adults and children are at most risk for inactivity. Unhealthy diets with low intake of fruits and vegetables or high consumption of trans fatty acids are associated with poor health outcomes and overweight and obesity. The U.S. has seen a surge in obesity rates as poor dietary habits and lack of physical activity have become endemic. Most alarming are the rates of obesity among children. There are many models for behavior change interventions. In the 1970s and 80s, public education campaigns and health education orientation to individuals were predominant. They were based on a belief that poor health behaviors were related to lack of knowledge and that raising awareness of harmful behavior and the benefits of healthy behavior would motivate change. While these strategies had modest benefit, they did not achieve the success that was anticipated. Research findings indicated that people need only motivation, but also new skills and supports to succeed in changing deeply ingrained health habits. Social learning theory combines education and skill development to change behavior, combining multiple strategies with a long-term perspective. The stages of change model developed in the mid-1980s continue to shift from individual to population intervention. Social marketing strategies are an example of a population-based approach using the concepts and tools of successful commercial marketing to challenge health behavior change. Basic marketing principles and methods are used, such as market analysis, audience segmentation, with a new focus on consumer wants and needs. This strategy is particularly effective in reaching underserved populations. The stages of health behavior change. In pre-contemplation, the individual has no plans to change behavior and does not see the behavior as a problem. In contemplation, the individual has serious plans to change behavior within the next 6 months, weighing pros and cons and building support and confidence. The preparation stage finds the individual with plans to change that are imminent, with small initial steps taken. Action is characterized by active attempts to quit smoking, drink less, become more active, or change to a healthier diet, and to sustain changes for up to 6 months. Maintenance is demonstrated by change that is sustained beyond 6 months. Relapse is the stage where the individual returns to an earlier stage and begins to recycle through those earlier stages. Another very successful model that's now being integrated into clinical services is the 5 A's. This model is not time-consuming, taking 2 to 3 minutes, and can be added to a clinical encounter with minimal staff training. This model began with tobacco cessation, but can be used with other behavior changes. The first step is to ask about tobacco, then provide clear and personal advice, followed by the agree step, when the individual agrees to start steps to quit and establishes a plan. The assist step includes a motivation intervention for those ready to quit. This might be a quit line and/or medication, and the arranged follow-up includes planned visits, calls, or contact to reinforce progress. The 5 A's has been found to be one of the most effective and cost-effective of all clinical prevention services. This population-based intervention model is based on the social ecological model that looks at a person's health behavior at multiple levels of influence. The interpersonal level that includes the characteristics of the individual, such as knowledge, skill, and motivation. The population level, which in this model is based on the community where the individual exists, and the state and national level is the overarching policy at the state and national level that influences the community and the individual. This model looks at the downstream results and considers individual interventions, but then looks broader to the midstream population level and upstream to the state and national level. An example of this is tobacco use. The downstream effects are individuals addicted to tobacco with health problems. The interventions at this level are individual clinical interventions. The population level looks at smoking at a community level with midstream interventions to prevent youth tobacco use and 24/7 smoking bans in schools. Upstream interventions are tobacco taxes and raising the age to purchase cigarettes. As we consider how to change health-related behaviors, it's important to consider that behavior is complicated, so multiple approaches are needed, and these approaches have to be tailored to the population served. The last factor is partnerships. In any public health promotion or intervention, community partners need to be engaged and part of the process. The local health department cannot act alone. They need local businesses, schools, social services, media, and any other community members who can support prevention programs. The CDC Task Force on Preventive Community Services has recommended specific evidence-based interventions for tobacco control. These recommendations are midstream recommendations in comparison to the CDC clinical preventive interventions. These CDC recommendations are example of childhood obesity prevention recommendations at the downstream, midstream, and upstream levels. One of the most basic measures of national health quality is the extent to which patients receive recommended evidence-based care. Evidence-based guidelines exist for primary care interventions related to behavioral risks, but putting these interventions into practice is difficult. Providers simply do not implement these interventions. Educating providers is only part of the answer. Strategies that also address Provider barriers like inadequate office support and limited time for visits have been proven most effective. Ultimately, changing health-related behavior is key to improving health and healthcare.